Can a woman ovulate twice in 1 month? Listen to the answer to this question. It might sound complicated, but if you pay attention, you're actually going to understand. A woman ovulating twice in 1 month may be possible, but ovulating twice in one cycle, in one menstrual cycle, is unlikely. It is not possible. During ovulation is that day a woman's ovary releases egg, okay, for fertilization. During that ovulatory period, the woman's ovary can release more than one egg, and that is what we call hyperovulation. Okay, if a woman has short cycle length, a cycle length of 21 to 23 days, it means she's likely to menstruate faster and also ovulate faster. For instance, a woman with short cycle length can have her first menses in the beginning of the month. That means around the early dates of the month, and she's having another one towards the end of the month. And in this process, this woman menses can return faster, and she can also ovulate faster within that 30 days or 31 days in a month. So it is possible for it to happen in 1 month, but it is not possible for it to happen in one cycle. Can a pregnant woman fast? This is the question one pregnant woman is asking. Now listen, fasting in pregnancy depends on the pregnant woman's health condition. A healthy pregnant woman without complicated pregnancy can safely fast. That is, if her healthcare provider allows it. You should know that fasting for too long or staying for too long without food in pregnancy can actually increase your risk of having dehydration, dizziness, low blood pressure, and inadequate nutrient intake. Before you engage in any fasting in pregnancy, please let your healthcare provider know. Even if your pregnancy is a healthy one and you were given the opportunity or you were given the approval by your healthcare provider to fast, in the period of your fasting, you begin to notice you're having dizziness, severe headache, the color of your urine has changed, you are feeling somehow as if you're fainting. Please terminate that fasting immediately and take yourself to the hospital, especially if you can no longer tolerate even taking as simple as water. Please take yourself to the hospital immediately and inform your healthcare provider. Towards pregnancy week, do babies begin to assume their held down position? Held down position is the cephalic position, that position that favors vaginal delivery. Now, during pregnancy, especially during the early stages of pregnancy, babies, they move around, they rotate because they still have enough room in the womb to move around. By third trimester, that is around 28 to 32 weeks, most babies will begin to assume the head down position, although they can still move frequently during this period. So if you're pregnant, you must have gone for a scan. Your pregnancy is around 32, 33, 34, 35 weeks, and the scan says your baby is in a breech position. You shouldn't be so agitated. You shouldn't be so scared and worried because most babies can still turn before 36 weeks, okay? So still carry on with your usual pregnancy activity by staying physically active. Avoid staying in one position for a long time. Move around, okay? Before you begin any exercise or position, you may have been advised that would help or that may help to change your baby's position from breech to cephalic. Ensure you listen to the instructions of a healthcare provider, okay? If by 36 to 37 weeks, your baby is still in a breech position, your healthcare provider may recommend what we call external cephalic version, where the healthcare provider can just externally gently turn your baby, okay? But if that doesn't happen, they might also recommend you having your baby via cesarean section, which is a normal type of delivery.